For people who are being cared for in a hospital or long-term care home, infections can be very serious. Many infections are caused by germs which are spread from person to person. As a visitor, you play an important role in controlling the spread of these germs. Infections are spread by germs which are everywhere around us, even though you cannot see them. Whenever you touch something, for example, door handles, elevator buttons, or railings, you can pick up germs or leave germs behind. In some cases, infections are spread by a person coughing or sneezing without covering their mouth and nose. As visitors, you can easily pass germs on to your loved ones. Proper hand hygiene or cleaning is the best way to reduce the spread of germs and infections. There are two different types of hand cleaning: alcohol-based hand rubs and soap and water. Research has shown that using an alcohol-based hand rub is the best way to clean your hands if they are not visibly dirty. Hand rub stations can be found at many points within the facility and should be used when you come in, before you go in to see your loved one, after you leave their bedside, and on your way out. Alcohol-based hand rub technique. Use 1 or 2 pumps to get a loonie-sized amount of the rub on your hands. Work the rub into all parts of your hands until your hands are dry. Make sure you get the hand rub between your fingers, around your fingernails, between your thumb and fingers, and around any rings or jewelry. This should take about 15 seconds. It is best to use soap and water if your hands become visibly soiled, after using the washroom, and before you eat. Soap and water technique. Turn on the taps and wet your hands. Pump a loonie-sized amount of soap onto your hands. Rub your hands together, making sure you get soap between your fingers, around your fingernails, between your thumb and fingers, and around any rings or jewelry. You need to have contact with the soap and water for 15 seconds. Dry your hands thoroughly. Remember to turn the taps off using the paper towel so you do not pick up any germs that may be on the taps. All healthcare workers are taught to clean their hands with alcohol-based hand rubs each time they enter a patient or resident's room. If in doubt, please feel free to ask our staff before caring for your loved one, "Did you clean your hands?" They'll appreciate the reminder. Some of our patients or residents may have a particular germ or infection that could be easily passed on to others. For these people, extra precautions may be necessary, such as wearing a gown and gloves. A mask with eye protection may also be required. There will be a sign outside the room asking you to speak to a staff member about the extra precautions you should take before going into the room. It is very important that you follow these instructions carefully. Visitors are not required to wear gloves while visiting unless they are giving care to the patient or resident that is similar to the care provided by staff. This could include handling used tissues or helping clean up after using the bathroom. Before you put on gloves, you need to clean your hands. If you have questions about whether or not you should be using gloves, talk to one of the staff members. A gown will protect you from taking germs with you on your clothes when you leave the room, but it must be used properly in order to be effective. A gown should be used if there's a contact precaution sign outside the room or in the bed space of the person you're visiting. It should also be worn if you are helping someone with an activity that could cause your clothing to become soiled. A gown is worn with the opening at the back. It needs to be tied at the neck and waist so that it stays in place and keeps your clothing covered. If the person you are visiting is on droplet precautions, you will be asked to wear a mask and eye protection to protect you from germs spread by coughing and sneezing. You should always clean your hands before you put on your mask and eye protection and after you take it off. The mask needs to cover your nose and chin and should never hang around your neck. For people who wear glasses, eye protection still needs to be worn over the glasses to stop germs from getting on them. You need to put on the mask and eye protection before you get close to the patient's or resident's bed space. No matter what protective equipment you're asked to use, it is important for you to remove it when you leave the room, even if you're just going out for a minute. This will help stop the spread of germs to others. When taking off the protective equipment, gloves, gown, mask, and eye protection, it is important to do so in a way that does not cause any germs that may be on the equipment to come into contact with your clothes or skin. Removing gloves. Using one gloved hand, grab the other glove at the palm and pull off the glove. Slide the fingers of your ungloved hand inside the cuff of the other glove and pull it off, turning it inside out so it contains the other glove. Throw them in the waste can. Untie the gown at the neck and waist. Slide your hand inside the cuff of the gown and pull it over your hand. Use the hand covered by the gown to pull the gown off the other arm. Gently roll the gown up with the dirty sides together. Put the gown into the laundry bin if it is cloth, or the garbage bin if it is a paper gown. Clean your hands with the alcohol-based hand rub. Make sure that you have cleaned your hands. Take off the goggles or face shield using the handles or elastic band. Put goggles in receptacle marked for cleaning. Place disposable face shields in the garbage. Lean slightly forward and remove the mask using the elastic ear band. Lift it away from your face and put it in the garbage can. In some cases, the mask and eye protection are one unit. This unit would be removed as you would remove the mask. Clean your hands with the nearest alcohol-based hand rub.
Nobody wants to see our patients or residents suffer unnecessarily from an infection that was unintentionally spread to them. As family members and visitors, you're an important part of the healthcare team and can help minimize the risk of exposure by following the steps outlined in this presentation. Together, we can reduce the spread of infections and make our healthcare facilities a safer place for those who need to be here.